separate medical fact from fiction. I want to start with a short story. A woman in her 70s sits at my clinic counter, a paper grocery bag full of pill bottles. She says, "Doc, I'm dizzy all the time. My son says I look foggy, and my laundry list of medications just keeps growing. I don't know which one is the problem." She looks tired, worried, and relieved to finally bring it up. That moment, when someone is overwhelmed by pill burden, is exactly why we're talking today. Quick but crucial safety note before we go any further. Do not stop or change medications on your own. If you feel dizzy, short of breath, confused, or have chest pain, say those words, call 911, or go to the nearest emergency department immediately. This episode gives conservative, non-prescriptive guidance to help you talk with your clinicians and pharmacists. Your provider or pharmacist needs to authorize any taper or stopping plan. Read that again with me. Clinician-authorized tapering only. So why do medications linger for months or years after they should? There are a few common forces at play. First, legacy prescribing. One clinician starts a medicine, and then patients see someone new who doesn't want to change what works. Second, multiple prescribers. Different specialists may each manage a different condition without a single medication gatekeeper. Third, fear. Fear of symptom return, fear of rocking the boat, and simple inertia, because stopping a medication takes planning. All human, all fixable with better communication.
Next, how to prioritize candidates for deprescribing. We focus on risk. High-risk classes commonly flagged include benzodiazepines for sleep or anxiety, long-acting opioids, proton pump inhibitors used for years without reassessment, some older diabetes drugs like sulfonylureas that can cause low blood sugar in older adults, and medications with strong anticholinergic effects that contribute to confusion and falls. This is not a blame game. It's risk management. If a medication matches one of these, it's a good candidate to review with your care team.
Okay, the heart of today, a stepwise verification checklist you can use or read to your clinician. 1. Confirm the indication. Why was this drug started? 2. Check the duration and last effective date. When did it help last? 3. Review labs or vitals needed to continue it. For example, renal function for many drugs, A1C for diabetes meds, or electrolytes for diuretics. 4. Screen for interruptions and cumulative side effects. Does this plus that cause falls or cognitive fog? 5. Review goals of care. Is the medication aligned with current health priorities? 6. Assess social supports and ability to monitor changes. Use that checklist as a conversation map.
Taper versus stop. General conservative principles. If a drug causes physiological dependence, benzodiazepines, opioids, some antidepressants, we taper slowly under clinician guidance. If the drug's purpose has disappeared and there's no withdrawal risk, maybe certain overused antacids in someone without ongoing reflux, then a supervised stop may be reasonable. Typical taper rhythms vary. Benzodiazepines often require weeks to months. Opioid tapers are individualized and slow, and many other meds can step down over days to weeks. Important. These are principles, not precise prescriptions. Your provider or pharmacist should give exact dosing changes and monitoring steps.
Let's make it practical. Exact language you can use. One-line script for a patient portal or quick phone message. I'd like a medication review to see if any of my current medicines can be safely reduced or stopped. Please advise or schedule a deprescribing review. Two-line script for a longer message or voicemail. Hi, this is your name. I take several long-term medications and I'm experiencing side effects like dizziness and memory problems. I would like a clinician-authorized deprescribing review and to discuss a conservative taper plan if appropriate. Please call me to schedule or advise next steps. Say it calmly. It's simple and actionable.
Pharmacists are your allies. Ask a pharmacist, can you review this list for interactions, duplications, and withdrawal risks? Can you draft a pharmacist note for my clinician with suggested monitoring? What to include in documentation, medication name,
dose, start date if known, reason it was started, current side effects, and what you're requesting, a deprescribing review and monitoring plan. Here's a simple clinician-ready summary template you can paste into a portal. Patient requests deprescribing review. Current meds, list. Concerns, side effects. Goal, reduce pill burden while avoiding withdrawal or disease relapse. Please advise on shared taper monitoring plan or pharmacist-led consult. Copy that into your message. It saves everyone time.
Monitoring plans are what keep deprescribing safe. Think symptom plus timing. For withdrawal, you might watch for increased anxiety, insomnia, sweating, rapid heart rate, or return of pain. Note when these occur, how severe they are, and whether they change over 24 to 72 hours. For disease recurrence, document objective signs like elevated blood sugar readings, return of reflux symptoms needing antacids, or increased blood pressure. Write down when the change started and call your clinician if symptoms are severe, rapidly worsening, or you see red flags. If you experience chest pain, sudden shortness of breath, severe fainting, or loss of consciousness, seek emergency care now.
Coordination is practical. Update your medication list and include photos of the bottles on your phone. Notify any specialists who originally prescribed the drug. Arrange follow-up checks and labs before a planned taper when appropriate, and involve a caregiver or family member who can report changes. If you have a pharmacist-led medication review service through your clinic or local pharmacy, schedule it. If a medication was started by a specialist, oncology, transplant, certain psychiatric meds, make sure they are part of the plan. Those are specialty exceptions. Don't try to manage those on your own.
Before we wrap, 3 concrete tonight actions you can take right now. 1. Make a 1-page medication summary. List each medication, dose, why you take it, start date if you know it, and take photos of the bottles. 2. Send the 1-line deprescribing request in your patient portal, or leave the 2-line voicemail with your clinic. 3. Schedule a pharmacist review, or make a plan to bring your med bag to your next appointment. Those 3 steps move this from worry to action, and they set up a clinician-authorized safety-first process. A couple final notes. If your provider suggests a taper, ask for concrete monitoring instructions and a point of contact. Who should you call if symptoms start or get worse? Ask whether any labs are needed before or during the taper. Keep a symptom log for the first weeks. And if you feel dismissed, bring your 1-page summary and the clinician-ready template directly. It's a neutral, practical way to center the conversation on safety, not blame. If you're a caregiver listening, be the lookout. Write down observations, falls, confusion, daytime sleepiness, low readings on glucose meters, and share them at the deprescribing review. Pharmacists and nurses often appreciate those concrete notes. And one more gentle reminder. All right, to summarize in 3 takeaways. 1. Do not stop medications without clinician or pharmacist authorization. 2. Use a simple checklist. Indication, duration, labs, interactions, goals to prioritize what to review. 3. Bring concrete tools. A 1-page meds list, the deprescribing message, and a pharmacist consult to start a safe, monitored taper or stop. Small steps, coordinated care, better safety.
If you found this helpful, subscribe so you don't miss future Safety First explainers. In the show notes, I'll include the 1-line and 2-line scripts, the clinician-ready summary template I quoted, and a downloadable medication summary template you can print or copy into your portal. And remember, clinician partnership keeps you safe. Bring your questions, your med bottles, and your notes. Until next time, stay informed, stay compassionate, and always put safety first.